Video. In this video, we will study about the neck of the femur. Okay, the upper part of femur has a part called neck, and in this we will study about this neck. Okay, so this is the anterior part of the neck, and this is the posterior part of the neck. So this connects the head of the femur with the shaft, and it is about 3.7 centimeter long. Then the neck, okay, like this we have to do it. The neck has two borders and two surfaces. Okay, one is this, the upper border, and this is the lower border. Then this upper border is concave, like you can see it, it is like so it's a concave. The upper border, this is the upper border. The upper border is concave and horizontal, and it meets the shaft at greater trochanter. Okay, from the back side also we can see that the upper border is concave and it meets the shaft at the greater trochanter. And the lower border is straight and oblique, it's straight and oblique, and it meets the shaft near the lesser trochanter. Then this is the anterior surface of the shaft, and this is the posterior surface of the shaft. Let's talk about the anterior surface. Okay, so the anterior surface is flat, as you can see it is flat. The anterior surface is flat and it meets the shaft at the intertrochanteric line. Okay, it is flat and meets the shaft at the intertrochanteric line, and it is entirely intracapsular. And the articular cartilage of the the head has a articular cartilage, and the articular cartilage of the head may extend to this surface, and posterior surface is convex from above downwards. From here it is convex like this, from above downwards, and concave from side to side. From side to side it is concave. It meets the shaft at the intertrochanteric crest, it is the crest, and it meets the shaft at the intertrochanteric crest. Okay, then only a little more than its medial half is intracapsular. Its medial half, little more than that, is intracapsular. Then the posterior surface is crossed by horizontal groove. It has a horizontal groove for the tendon of obturator externus to be inserted into the trochanteric fossa. Okay, this is trochanteric fossa, and it has a groove for the tendon of obturator externus to be inserted into the trochanteric fossa. And now let's learn about the angles. So the angle that the neck makes with the shaft, like this angle, this is the neck and the shaft. Here a angle is formed. Okay, and the angle made by the neck and the shaft is called the neck shaft angle. It is about 125 degree in adults. It is less in females, about 120 degree, due to the wider pelvis. The angle facilitates the movements of the hip joint, and it is strengthened by a thickening of the bone called the calcar femoral present along its concavity. Then trochanter shaft angle. The trochanter, this is greater trochanter, this is lesser trochanter. The angle between the trochanter and the shaft, this angle, okay, like this and this angle, this is 8 degree, 8 degree. Okay, in adults, and it is an important radiological parameter which provides idea of direction of medullary canal and its alignment within the greater trochanter. Now now what else is left? Now we have the angle of femoral torsion, or the angle of intervention. It is formed between the transverse axis of the upper and the lower end of the femur, and it is about 15 degree. Okay, it's not that much important. Now let's learn about this next thing, the blood supply. The intracapsular part of the neck is supplied by the retinacular arteries derived chiefly from the trochanteric anastomose. The vessels produce longitudinal grooves and foramina directed towards the head. Mainly on the anterior and posterior superior surfaces, the extracapsular part of the neck is supplied by the ascending branch of the medial circumflex femoral artery.